Okay with everyone? Because I know there's a lot of students that are working. Just got to get the PowerPoint to come up. Not sure why it isn't. Give me 2 minutes to get this PowerPoint to actually work properly. Right, that should have it. How's everyone going this morning? Are you all madly trying to keep up work and uni? Right, so I can see we've got 11 people online. I have my PowerPoint ready. And basically today is a really open session to ask questions and to sort of get your head around the next assignment. But I'm also going to sort of add in some details from our marking of assignment 1 because we're halfway there, so which is good because we would like to get it sort of all done so we actually get an Easter break. So hopefully as you've been working through the modules, you've really started to understand that there's much more to managing complex clients than experience. A lot of the times that when you're looking at the complexity of patients, it's all the other interacting factors that makes the difference between a patient doing well and then other patients not doing so well. And our assessment 3 really looks at when things didn't go to plan. So just to sort of go over with it's 1500 words now. We still had some students not understanding that the rules in the university have changed. 1500 words is not over or under anymore. It is 1500. So if you marked over, you did lose 0.5 in the sort of presentation. If you had under, it's more that you won't then have answered the question correctly. But we had some students which had like 100, 200 words over, which then means that penalty plus also we stop marking at the 1500 word mark. So just be aware of that. And which is why now we've actually been adding in sort of like estimation of words. So you can see here that we've got an introduction 150 words. Now, this is not something you have to go, oh, well, I have to have that, but it's a guideline. So you can see that, that's about how I meant to write. And remembering that these are our word count is literally linked with the marking criteria because there are some areas that have a lot more marks. And so we expect you to be writing more depth in that area. So the main thing is to start thinking of your complex client. So you're introducing your essay. So this would be about your client. What are the risks? Why this particular cohort of clients? Why is there risk of deterioration? Now, I've had a lot of questions from students, which I've been asking, which is great. You can just email me and I will answer your questions. So we've had like, is pediatric asthma complexity? Yes, the same as, patients turning up with chest pain and STEMIs and non-STEMIs because they are so much at risk of deterioration if things aren't managed correctly. And so you can see here that our 300 words for our summary of our chosen patient. So making sure you really have your references in this area. This is not just a descriptive summary, but what makes this patient complex. Use statistics, really provide that, 1 in 3 of these patients will, have long-term side effects if not managed correctly, or whatever the incidence is, that, we particularly like in things like stroke, there's a lot of statistics that if you don't start to manage within a certain time period, the percentage of recovery reduces dramatically. So these are things that you can have in your summary. Your summary is not just that these patients come and they have different aspects of their treatment in hospital, but what makes them complex. And when we think about it, there's a lot of diseases, even delirium in fractured, in older patients with fractures is a major risk factor because of the fact that it causes so much long-term effects and risk of sort of much more detrimental period in hospital. And so then clearly and concisely priority discuss, sort of looking at the priority and discusses issues that create complexity. So this is where you might sort of talk about, the risk of, even if it was like an ICU patient, the risk that, whenever they get transferred or moved, that increases the risk of things going wrong. Talk about a framework that you might be using as that assessment. And so think, I know we've got our main frameworks, but you might actually have one that's related to your disease. So, there's a lot of sort of that as assessment frameworks for deterioration in asthmatic patients, in diabetic patients. So think about, is there a framework that I can be using? Um, and the discriminating between high quality evidence, really remember back to your Bachelor of Nursing research, how we talked about depth of research. So which journals are they published in? Are they high quality journals? Have they got a sample size which is an appropriate sample size? Is it qualitative or quantitative? Is it longitudinal if you're looking at risk factors over a period of time? So these are things you'll notice in our marking, that when you're getting it back, that we will have sort of said that, you might have had 3 high quality journals, but then the others were websites or low quality journals. So thinking about your quality of your references. And so when we then look at the marking criteria, so 45 marks, so clearly and concisely, I don't know, that is a spelling mistake there. Priority clearly and concisely identifies priority and discusses issues that create complexity in the chosen patient. And so really think about sort of how you're presenting that. And because this is actually only a small part of the word count, think about your words. So concise means looking at double descriptives, I call them, where you're saying the color is black. Well, if it's black, it is definitely a color. So thinking about, the way you might describe your patients. So, that you don't need to say they're, at increasingly more risk, because it's either increasing or more, one or the other. It doesn't need to be both. Thinking about sort of if you're describing the family aspect, that you only just need to describe it concisely. The family is a large influence, or an influence in this patient cohort because of these factors. This, particularly if you're looking at pediatrics, the family is a big influencing factor on how well this child does, because it's about that history, that connection, reduction of anxiety, all are factors which influence a patient's trajectory. Excellent communication of the background of the patient. So looking at sort of what other factors are influencing in this. And this is often then when you might include the family situational factors as well, which is part of the next criteria, but you start to introduce them in this sort of area. strong evidence again, and then able to discriminate. So once again, that discrimination of high quality and low quality. And this is where, again, sort of think about statistics. Don't just use it from the Australian Health Institute of Health and Welfare. Don't just use it from an article. That demonstrates you've understood that that's the quality that you need. And justification of sort of why this group. So if you're looking at, so maybe, English second language, Indigenous, what is the justification that these are higher risk than the everyday patient? I might just stop there. And has anyone got any questions that they either want to put in the chat in relation to their groups? Emails that I've had have really been people just asking about their groups. And so sometimes if you wanted to sort of present your group, then I'm sure other students who are watching this recording will also go, oh, that's good. I know that my group is a at-risk group. Um, have you thought about your groups, the students that are listening? Well, maybe we just have, so we've got 11 students. So if everyone puts in, oh, so Analia is still trying to decide. So put in the area that you're working and let's have a discussion about what are risk patients in your area. Even if you're working in a nursing home, you know, an acute urinary tract infection puts this patient at high risk. So it doesn't actually mean that everyone has to be working in intensive care or emergency, because high risk is in relation to your area. That's how you make sure that when you're providing that evidence that you are clearly identifying. Um, and and so when you think about justifying, so if you're in a medical or a surgical ward, um, that you then are sort of able to, then you'll need that justification. um, ICU, every patient is at high risk, but then think about, you might have a patient that is a post-surgical patient, that then your risk factors are increased by bleeding, even in a ward situation. So you think of orthopedic surgery, what are the risk factors with these patients? You've got your simple risk factors of bleeding. You've got then more complex levels of clot, which then pulmonary embolus, um, cerebral emboli, or myocardial infarction from an embolus. So then that's your risk factors. So that think about your patients that you're caring for, because it's so much easier and I think better for your own trajectory if you look at it in patients that you're working with every day. Because you know that there are times when your patients that they're much higher risk and they're complex patients. Um, so think about the patients that are in your areas that are at risk. In pediatrics, again, a lot of pediatrics are just at risk, and you've got then to make sure you include the age, because in few of the posters they had sort of like pediatric patients, but if you've got a 11-year-old, much less risk than a 5-year-old with asthma. So make sure you include that risk factor of the age. And what does the research say in relation to that age? Does that sort of make sense about sort of thinking about your complexity of your patient? Um, if you're not working in an area, but you're also looking at sort of wanting to move, this is an opportunity to sort of think, well, I'm going to build my evidence on that particular area where I want to move. Yes, and see, um, when you're looking at post-operative emergency laparotomy, some of the risk factors are the patient size. So remember to think about what makes some patients more complex. It's their age, risk of delirium, their patient size, their comorbidities. So this is how you then add in the complexity of your patient. You know, a 60-year-old with no comorbidities and not overweight probably doesn't have much risk factors. But then you add in, and then you might sort of say, well, if they were having their surgery at 80 and they were overweight, they had comorbidities, that makes them more complex. So think about sort of how, if you sort of, as you're going through your patient factors, you go, oh, they're not really that at risk. Well, then add in some risk factors, because we know then, and look at the research that looks at so what makes some patients higher risk than others. If you're, like we also have sort of the pediatrics and the emergency, but we also, in this course, I think might have some some nurses that are working with women in sort of the maternity midwifery area. So, again, complexity in that condition as well. So remembering that, yeah, your complexity of your patient is what you present to us. Um, it doesn't need to be something that you are looking after every day, but then you might have sort of ideas of how to make this patient more complex. Um, and so that's sort of, and just remembering your evidence, and looking for, well, sort of recently published journal articles in good journals that have got, good patient numbers, even if they're qualitative. What are they providing with that? And so then the next part is situational factors. So again, a lot of marks in these two sections. So thinking about, am I writing enough to get the mark? So we've got here critique of the situational factors. And so there's a whole module about situational factors, from organization, family, you as the nurse, to communication. So think about all those factors that influence, and remembering to think about the evidence in the literature that talks about these factors. There's been a lot of research about sort of this situational factors about staffing. So whether it's staff mix, staff lack of numbers, staff, transitioning to different areas. So you may have staff, but some of them, half of the staff are agency. Those are situational factors which make your ability to care for this patient and reduce their risk factors a lot more difficult. And then 350 words on your nursing management plan. So making sure it links to your complexity of your patient and your situational factors. We are allowing dot points or numbered plans. So you can sort of think about, if you're presented risk factors, making sure they then follow on in your sort of management plan. And then the conclusion as well, fitting in that area. And so again, thinking of your literature, that it sort of links both to your situational factors, and then supports your evidence in your nursing plan. So if you're looking at a nursing plan, this is where you may actually use, some of the sort of implementation plans that you have in your clinical areas, such as, asthmatics, diabetics, post-operative plans that have, specific management for different days. And so thinking about, does that align with your management plan? What is the evidence that underpins this, plan that you're using in your hospital? And so that's where you go back to the policy that sort of talks about it. Look at the evidence. Is it current evidence, not current evidence? And that may then become part of your organizational situational factors, that you're actually working with these complex patients with, outdated information that isn't really the current research. So that can be some of your justification for then your nursing plan, that needs to have current evidence about what are these patients, how do I reduce the risk, how do I make sure the staff are using, correct handover documentation plans, making sure that, medication administration does align with the comorbidities of this patient. Any questions? Am I making it easier or harder for you to sort of think through what your patient and the module information was? Hopefully making it easier. So again, as we look at the risk factors, not the risk factors, the criteria, clearly and concisely critiques the situational factor. And so I think being aware of this word critique, this is not a summary. This is you actually saying, this is a good aspect, this is a poor aspect, this is something you need to do differently. So you might identify situational factors, which then you critique to say are really poorly managed in my, with this cohort of patient. And so this may be that, you know, we know that, patient handover is a situational factor. But then your critique might say that we're not actually doing this really well, which puts our patients at higher risk. Also, if you're looking at inclusion of the family, so the family we know becomes a situational factor. That can be good or bad. So is family inclusion working well in your area, or is it working poorly? Is it a benefit with this type of patient, or does it actually add more risk factors to the patient? Um, is that how you're thinking of your situational factors? You're sort of, as you're reading the modules, you're going, oh yeah, I hadn't thought of the factor that including the family adds more time, but in that time it actually may reduce the risk for the patient. So it's about then making sure in your nursing management that you allow time for including the family in conversations to then reduce the risk for that patient. So if we're looking at a pediatric patient, that just seems to make sense. But how often does family often left as the last aspect of what we then to have as those discussions with them? Or is your area in really having a family focused way of delivering care where family is included on each step? And then looking at the literature that supports that aspect, whether it's looking at sort of, updating policies regularly as part of the organizational situational factors that we need to look at. And then as you're putting that into your sort of comprehensive management plan, that part of that management, may be that you're sort of looking at, evidence-based policies that you can follow that may need to then sort of have, if you're sort of looking at that as a situational factor, that sort of policies need to be in the forefront of of nurses. How are they being used? What does this management mean for this cohort of patients? And how can I make sure that I'm looking at the risk factors and thinking about, you know, how does the organization support me to look after this patient, or the equipment? Is that, up to date? This is that then critique that you might include in your assignment. Questions? And then the last 15 marks again is presentation, references, and again, so looking at sort of 8 or more, but it's about sort of that they're from a good source. So predominantly sourced from a range of peer-reviewed research. So what we do is we just check, make sure it's APA. A few of the ones that were in A1 have not been APA, so then they've lost a lot of marks in referencing. And so this is now worth 15 marks. So this is your presentation, grammar, punctuation, flow, which is your organization of ideas and logical sequence, 100% correct spelling, making sure you're looking at Australian, so making sure it's S's, not Z's, and then you're referencing in text, so thinking about making sure as you're going through, if you're presenting a new concept, that it needs to be references. If you're saying literature says, then it needs to be referenced. If you're presenting information, it's not that you just have a reference at the end of that paragraph. It needs to be the end of each sentence, which has a sort of a point, which is not from your experience, which is from the knowledge you've looked at in research. So as we're looking at this, we sort of look at 15 marks, and so 10 of those would be on your referencing, correctly referenced APA in text and in list, good quality references, enough references that each point is referenced within the assignment, and that then the 5 marks on spelling, grammar, and punctuation. Remembering word count is exact. Or close to, it's not, if it's not over, and if it's then sort of, and it's about sort of, we do actually check, we download and check the word count. Also with the references, making sure that their DIO is correctly presented. Often if you just copy it from the actual journal, it may not be presenting correctly, so make sure you go in and make sure it's APA, the journal article in italics, and then DIO correctly presented. And so we've got a comment here. So remembering this is actually like it's not a patient, it's it's sort of patient but cohort. So because you're going to need the information, so what you're looking at then is not the toe amputation and the DVT, it is probably patients with cardiovascular disease. And so then this is what makes them so complex, because the comorbidities, the risk factors of developing DVTs and then pulmonary embolus, are all then, and your situational factors probably would have been that didn't get walked early, that maybe there wasn't enough cohort of staff to actually manage that level of complexity on the ward. So it's sort of, even though it says your chosen patient who is at risk, think about that as a patient. Why were they that at risk? Because of their cohort, their age, their comorbidities, and then the factors that then are around that is then the staffing. The physio, maybe they didn't get walked early enough, they didn't have the right equipment to reduce the risk of a DVT. Their patient was non-compliant because of lack of language skills or health literacy. So thinking about what makes this patient and that patient group complex, because you're not going to find research about a patient, but you're going to find research about that complexity of that patient cohort. Any other questions? Is everyone managing to work through the modules quite well? You're finding them interesting and they're making you think about sort of complexity of your patients and situational factors? Yep. And as you're working through, I think it's really good to reflect on your own ward area, and how, you'll have some shifts where you go, that was just a bit crazy. But then when you actually reflect and think about the situational factors that made that shift, um, you know, with much higher risk, and, that sense of how did I actually even manage that? You'll actually notice that you'll probably have different staff levels, lack of a really clear team manager that may have sort of been able to work. Maybe she was pulled away to different emergencies. But also then you look at the complexity of the patients in your ward. You can really then sort of go, that's why this felt really complex. Yes, exactly, what Alana then said. So your patient is a 75, but it's the complexity of the COAD. They've often then got comorbidities. They're older at 75. They're also thinking about the age, female, um, is what is the health literacy level of your patient, and does that also then influence their comorbidities? You'll often have then with COPD, past history of smoking. Are they still smoking? Have they got, underlying complexity of maybe a cancer diagnosis that they've also had treated? So yes, so that you can, as you're presenting your patient, the think about that as a sort of a different a cohort of patients, and then you may, if you've got someone that's not as complex, add in complexity to them so that you've then got different factors to talk about, or if they're too complex, reduce some of that complexity so it fits in your word count. So you're presenting a summary of your chosen patient, so it's not like it has to be that exact patient. It can be sort of that you've putting together two patients, or you're reducing the complexity of one patient so you don't have too many factors within that cohort of patients. Everyone's understanding about the word count and the referencing, thinking about the complexity of your patient and making sure that your references, to find your references, like there is a lot of research about sort of situational awareness, movement and complexity of patients. So it is often fairly easy. There's also a lot of readings in the reading list, which you may be able to then use, or then have a look at those and then find references from those articles related to your patient and your patient cohort. Um, any other questions? When hopefully the week after Easter. And I'm actually away from Easter through to for 3 weeks, but Jake is taking over, so that you'll get email, but everything's set up just to run smoothly, which is why I was doing this seminar now. Because then you actually have sort of like vacation week, but that can be time where you just catch up, maybe on parts that you haven't done. Our marking is basically half done, so we're hoping that our markers get in, so the marks will come back, the week after Easter. That's what we're aiming for. And we've got in those markers, it has been, most have done sort of quite well. I think our means tracking about 70, 74, 75, up to 80, which is nice. Remembering the use of AI, it is really easy to see if students have used AI, because AI talks in a certain way. And so just be aware that you can use it to maybe, you know, find the current literature, just like you're doing a Google search, but then go to that literature, read it for yourself. Don't take AI summaries on the work. Um, Subheadings, you can use subheadings. Because we've got the criteria as fairly set sort of areas, using a titles or headings just does make it easier for us to mark, and it also, I think, makes it easier for you as you're writing it. So it's not that it's an essay that is 1,500 words, no headings. Yes, you can have headings. And when you're remembering this formatting, so that the font size, nice 1.5 spacings, so that all of those just falls into getting full marks in that area in the references, in that 15 marks. Next, I'm just picking up, I'll just might go to it. So I'm just going to change what I'm sharing. So remembering to check the readings out, the reading list, because this is where, when it eventually gets there, there's a whole range of readings which would be really great. So we've got the different modules, And see, these are all your current references. So module 2, these are sort of ones that would you use to justify your situational factors, but also your here's the family ones. So this is the current research. So I went through and added a lot of references in the beginning of this trimester to sort of look at what are the current research. So you might sort of, your cohort of patients often may have complexity of cares where then things get missed, and so these are great references just to use, that I've sort of provided for you. And then you've got sort of your module 3 ones there as well, which has got your different minority groups. Right. Don't forget to have a look at the reading and writing reference guide. So it opens in a new tab. This is APA, talks about how you're meant to, your writing and presenting your essay. So that, make sure you actually just have a look at that so you don't lose marks on that. It was only a few students, but it's just annoying when we sort of students lose marks for such a simple area. Well, that's basically all I was going to present. This was only a short, sharp. I do sit it as an hour, so it allows for any questions. The question there, do we add subheadings? Just simple, the subheadings go with the simple aspects on the assessment item. So you've got the introduction, and see, I would call then your sort of second heading critique of situational factors, and then your nursing management plan and conclusion. And it actually has used headings: introduction, patient summary, situational factors. It has in them the actual assessment criteria, the headings to use. So make sure you do read our assessment criteria well. So literature within the last 5 years, 2 or 3 seminal works may be used, but you allowed 2 or 3 websites, but some of the students in the posters had like 6 websites and 2 journal articles, so that doesn't provide us with high evidence. Looking at that, just checking that word count as well. And making sure you present the word count, student number in the middle, and page numbers, and your title page. Right, well, thank you very much for those that linked in, and for those that then will watch it. I will put this up, I'll probably make it accessible either on the Teams, or I'll stick it in as a YouTube as well. Any last questions, or I will head off to my next meeting. Okay, thanks. Enjoy your Easter. Hopefully you get some time off. And I have 3 weeks leave going to Africa for a safari. So hopefully that will be nice. It's a shame it's in the middle of trimester for me, but you can't change family sometimes. Thanks.